Hi, and welcome to a short session on ketogenic diet. So I came across an interesting study conducted by a psychiatrist in France. This person, Dr. Danon, has conducted a study about the benefits of ketogenic diet in mental health. And it was very interesting. What he has done is he has admitted about 31 patients suffering from severe mental illness or refractory mental illness in the hospital, and he has put them on a strictly ketogenic diet for about 2 to 3 weeks. And they have done a retrospective analysis of these 31 patients, and they have found that of these patients, most of whom are suffering from severe mental illnesses like depression or schizophrenia, bipolar disorder, 28 out of 31 patients improved after being on a ketogenic diet for 2 weeks or more. And further to that, they've also found that 64% of the patients actually required less medications when they were being discharged, and 43%, which is close to half the patients, achieved clinical remission while on a ketogenic diet. These findings are significant, even though it is not a controlled trial and it is only a retrospective analysis. They are very interesting because some of the major issues in mental health, especially severe mental health disorders, is that in the course of treatment, patients often tend to have a lot of other coexisting metabolic conditions. They tend to go in for obesity or type 2 diabetes mellitus, systemic hypertension. Many of them have thyroid conditions. So how do we improve the metabolic outcomes? This always tends to be a bit of a dilemma. This ketogenic diet has proved to be very promising, and it should be considered even for mild to moderate mental illnesses. I think looking at the findings, I feel that incorporating ketogenic diet in our day-to-day life can even do a lot of good for our mental health on the whole. It can probably even be preventive, given that research has shown that it's neuroprotective and also has a positive impact on cognition, and it seems to be reducing the inflammation. So there is less mitochondrial damage and there is less oxidative stress while being on a ketogenic diet. But how practical is it to be on a ketogenic diet, and how the diet actually evolved or was discovered was that they were trying out dietary solutions for children who were not responding to treatment of epilepsy or seizures as we know it. And that is how they came to formulate a ketogenic diet. A ketogenic diet is nothing but a diet that is sparse in carbohydrates and predominantly consists of fats and proteins. So an approximate proportion would be about 70% of fats and 25 to 30% of proteins, and a very small percentage, that is 5 to 10% carbohydrates. Is this practical in our Indian scenario? For any diet to be adopted, it has to have three main features. One is that it should consist of simple foods. Secondly, it should be easily adaptable, and it should be thirdly affordable. While looking at all the recommended foods allowed in a ketogenic diet, I think that it is suitable even in our Indian environment and in our Indian society. The only problem is that we are used to a lot of rice and grains, cereals and pulses like dals. So these are not part of general ketogenic diets, and that would be the only challenge in cutting these foods down in our diet. But other than that, what kind of food would be allowed that would be feasible and recommended? So we can have a lot of vegetables like cauliflowers, beetroot, brinjal, and French beans, capsicum, button mushrooms, spinach, greens, and just avoid root vegetables or starch dense vegetables, tubers, potatoes, for example. Fats and oils like butter, coconut oil, olive oil, and minimally processed cooking oils are fine. Butter, dairy such as paneer and high fat cream is recommended. For people who do have meat, you can have a lot of fish, chicken, and beef, etc. Nuts and seeds are also beneficial. Peanut butter is pretty popular. We can incorporate almond milk and sunflower seeds, pumpkin seeds, flax seeds, etc. Avoid sugar, and instead what they recommend is natural sweeteners like stevia or sugar replacements. Probably the challenge comes in regulating the sugar intake, because you have to avoid fruits, avoid processed food, avoid sweets and chocolates, avoid jaggery, honey, and carbonated drinks. Interestingly, tamarind is also something that they do recommend to avoid. Looking at all that has to be avoided, these are the things we instinctively reach out for whenever we have a craving, or when we're trying to regulate our mood through food. But like they say, that which makes you feel better in the short run sometimes does not really bode healthy in the long run. So maybe there's a reason why that is so. And so if you're trying to feel better, even though sugars do give you that perk up in the short run, try to avoid it, and reach out for some vegetable, dairy, or meat instead. Thank you.